Welcome back to Mornings with Luann and Tim. I'm Tim, and joining me now I have Barb Goff over down there. Hi Barb from Algoma Family Services, and I have Annette Katajamaki from Canadian Mental Health Association. We're going to be discussing, yeah, I got the name right and everything. Yes, I did. We were talking earlier, Annette saying, don't practice my name too much because people do that and then they screw it up when they get on air. Katajamaki, no, it's a great name. Finn? No, what is it?
Yes, it is.
It is, all right. So Barb and Annette, we're talking about the walk-in clinics that you have now for the walk-in counseling sessions you have for mental health that are going on. They've been going on for about 2 years now, yes?
Yes.
And this is a joint venture. Tell me about the agencies that are involved in these mental health walk-in clinics.
Well, right now there are 5 agencies that are involved. We started out with 3. So the first 3 that started were Algoma Family Services, Canadian Mental Health Association, and Algoma Public Health.
Great.
And then we were joined by the John Howard Society and the Sioux Area Hospital.
Oh, excellent. So you've got 5 partners now involved. And what was the reason for setting up these walk-in clinics?
Well, we had a lot of discussions at our systems table meeting where we get together monthly to plan and to kind of see where our gaps are for mental health and addiction services in Algoma. And one of the huge discussion points was our wait lists. We all had very large wait lists for counseling, lots of people needing service, and we really struggled with how we were going to manage that. And one of the ideas that we thought we'd try was, let's try a walk-in service and see if that makes a difference.
And has it reduced some wait times then?
Significantly.
Yes.
Yes, it has. We've having that available and accessible has made a difference in reducing the wait times because people get what they need in one session and then they don't feel they have to sit and wait and go for more.
Right.
Yeah.
We were talking about, before we went on air, we were talking about the waiting and how oftentimes in the case of certainly with people with addictions and other mental health issues as well, that timing is everything. That if you can't get the help you need when you're ready to receive it, you might miss that window of opportunity, which is another reason why something like this is a great idea, because then people can access it. You just show up and you wait in the waiting room and you get in when you get seen, but you're going to get that attention when you want it in that moment. Do you find that to be true, that that's important as well?
It's very important that people get some kind of service when they're ready to receive it. You're absolutely right. It makes a huge difference. The other thing we know is that the longer people wait, the less likely they are to actually affect some change. But secondly, it takes a lot more work if you wait longer. So the longer people are waiting for service, the more intrusive sometimes the treatment needs to be, the more time it takes. So it's wonderful.
And the other thing that counseling sessions are offering are sort of, I would say, guideposts as to what the next step might be. So yes, in some cases the counseling itself for that one session might actually be enough for that person in that moment, and for others they might require some follow-up care, in which case your agencies together through the walk-in clinic can help direct that person through the system, which is also, I think, can be very troubling for someone who is struggling with depression, anxiety, addiction. Those things can weigh you down so much to the point where you have a very hard time functioning. Picking up a phone book, going on the internet, doing that research to find out where you need to go can be so overwhelming for somebody who's already dealing with trauma. So that's one of the services you provide, correct, the counselors?
Absolutely. We do referrals to whatever agency is necessary. The nice thing about having the blended group of community partners is that we have a wide variety of expertise, and we share that. We share that with each other. We cross-train with each other, and then we're able to provide that and give that expertise to the client. So we give them referrals, and I think it's about 75% of our clients do leave with a referral. And it's their choice whether they follow up on that or not, but they do leave with a referral to resources that will be helpful to them.
And what about those instances where someone comes in and just sitting down and talking to somebody for an hour is all they need to get through? Like those are some cases as well, that there are people who just need an ear and some advice?
Absolutely. We have a lot of folks that just come in, they get that one-time counseling session. The nice thing about the way that the theory that we're using, the narrative and brief service, is that people leave with a sheet of paper. So they actually have notes that they can refer to. And, you know, these are the things I should practice, and this is what I should do when this happens. And it's really comforting for them to have a piece of paper that kind of values them and their direction, and they feel like, okay, I've got this, I can do it.
And it also validates what their issue is too. So you're not going in. You're going in and you're hearing somebody say, yes, this is important, this matters, and we can help.
Right.
And here are some things you can do. I call it like a toolbox, really, right? I mean,
Yes.
you're helping somebody arm themselves with the tools they need to battle whatever issue is they're dealing with, and then even just that, to get over that hump, to continue to do the work.
For sure.
Is encouraging. Now you've been with Canadian Mental Health Association for a number of years, Annette. How long ago did you start?
Why did you have to ask me that?
Because we're going to because the audience is going to gasp when they find out how many years you've been there and say, how does she look so amazing?
Yes, right. Through the beauty lens that you provide.
Yes.
32 years.
32 years with the agency.
Yes, sir.
That's okay. That's fantastic.
Yep,
And
yep.
Barb, also a long time member of the Algoma Family Services team.
Yes, coming up 19 years with Algoma Family Services.
I can only imagine the changes you've seen in the mental health and addictions and counseling services and family counseling over these years. Positive changes?
Absolutely. Lots of really, really good changes. Long overdue. Lots more needed, though.
Lots more needed?
Lots more needed.
I think, mental health has been chronically underfunded. And so finally, we are starting to get funding, and our provincial government is helping with that. And
Oh,
there
and
are
there's an election coming up.
There is,
in
yes.
just about, I guess about a week or so. And so maybe people would want to find out what the party's stances are on things like mental health and addictions, and where they
Yes.
stand on things like helping with the opioid crisis.
Yes.
So you could maybe ask your local politicians who are currently running where they stand on these things, because we've heard Algoma Family Services and CMHA are operating these walk-in clinics using your current budgets. There's no extra money allocated for these walk-in clinics. You
That's
guys
correct.
are just trying to make this work on what you have always had.
That is correct.
So some extra funding would be extremely beneficial.
Absolutely. I mean, we would love to be able to see this kind of service happen every day, maybe in multiple sites, because we know the downtown is really important from a transportation point of view for lots of people to access. But there's still lots of people that can't access the service, one, because it's downtown, and two, because of the limited hours. So right now, we're able to run from 11:30 until 7 o'clock.
Oh.
But our last counseling session starts at 5:30, because most of them are about an hour to an hour and a half.
See, that's something else that people have to remember, is that your average person is working from 8:30 to 4:30, 9 to 5, whatever. So to shift to get someone to actually commit to working until 7 o'clock, or and by the time they get home or whatever time, they don't just lock up the doors at 7. They've got more time on the clock to go. That's a whole shift in manpower. And you're trying to maintain your daytime services while offering into early evening services. I know Algoma Public Health was having the same issue. They wanted more frontline workers, but the funding wasn't there. And so you've got clients who may not be available between that 8:30 to 4:30 time slot. So then you get these backups at the lunch hour and right after work. So more funding would be ideal to actually have dedicated workers who can put these clinics on at those hours.
More funding is always ideal, and one of the things that I would point people to is a campaign that is running provincially right now. It's called Erase the Difference. There is an online petition you can sign, and it's to get the funding for mental health the same as physical health.
Oh, and that is where, Annette?
EraseTheDifference.ca.
Okay, great. Now we should talk about where the clinic is located.
386 Queen Street East, right across from Fabricland, at the Canadian Mental Health
That's
Association.
the corner
building.
basically the corner of Queen and Elgin, is
Yes,
that
sir.
right?
Yes.
Yes, okay. And so the walk-in clinic times again,
11:30 till 7, last appointment at 5:30.
and this is always the same day of the week?
Tuesdays, every Tuesday.
Every Tuesday. So Barb, Algoma Family Services, you have counseling on site as well
Yes, we do.
at your location?
At
which
our
is-
location, which is 205 McNabb Street.
And
That's
that would
our
be-
main office.
And that would be by appointment?
By appointment, yes.
And you do family counseling, you do children's counseling,
We do family, children, adolescents, family violence. We
everything.
have a wide variety, yes.
And the work you do is fantastic. I did work for a while with Algoma Public Health, so I've had the pleasure of collaborating with you ladies, and I know that the emails and the meetings go on. You do have a very, very connected base with all of the other agencies in our city. You work very hard to make sure that there are no gaps. You try to reduce those gaps, and it's much appreciated.
Thank you.
And I hope you stick around with CMHA until early retirement.
Yeah, okay.
After 39 years. And Barb, always a pleasure to see you as well.
Thank
Give my
you, you
best to
too.
Ali back at Algoma Family Services.
I will extend that.
Ladies and gentlemen, boys and girls, that's it for this interview. We'll be back with more Mornings with Luann and Tim in 60 seconds. Stay tuned.